Last week, former NFL defense lineman Lyle Alzado told NBC News that steroids were the cause of his inoperable brain cancer.
How long were you on steroids?
Most of my pro career. I played 16 years. And it got me where I wanted, but also got me very sick.
Lyle Alzado went from being the toughest son of a bitch in the NFL to being a sad, dying man. Everything I saw on TV taught me that steroids kill.
Some alarming news about steroid use tonight.
A drug bust in Phoenix, Arizona. Not for heroin or cocaine, but for something just as dangerous.
Health damage from steroids can include heart, joint, and reproductive problems.
This is a drug that kills.
But what happens is these retarded idiots that give us the news, these talking heads that babble on TV, give us this rhetoric that comes from not one single expert. And they say ridiculous things like steroids will kill you, they'll rot your kidneys, they'll give you cancer, they'll do all these horrible things that are just not true.
John Romano is a senior editor of a bodybuilding magazine, and he disagrees with what his media colleagues think of steroids.
Well, how come we hear constantly in the news that people are dying from taking steroids?
Show me the bodies.
Lyle Alzado.
Lyle Alzado didn't die from steroids. I trained with him for 2 years. He didn't die from steroids. I know he died from a brain tumor.
I don't know of any of my colleagues that link his central nervous system lymphoma to his use of steroids.
Dr. Charles Yasalis has published over 70 articles on the use of steroids and is one of the top experts in the world on drugs in sports.
Are steroids killing people?
Good question. They've been used in medicine since the late 1930s. I hope we haven't been purposely killing people. Can they be used safely? Yeah.
These drugs are a boon in the medical profession. They're a miracle drug for people with muscle wasting. They are a miracle drug for burn victims, for cancer patients, people recovering from surgery.
And for people with AIDS, like Jeff Taylor. Jeff has been fighting HIV for 25 years, and he says steroids saved his life.
Back in '92, I was down to 2 T cells and very sick. I developed PCP pneumonia. Both my lungs collapsed. I almost didn't make it. I came out of the hospital weighing 125 pounds. So I started researching and found a clinical trial in LA. It was studying Anavar, an old bodybuilding drug, to test how it worked in people with HIV. So I signed myself up, got a fairly high dose, and responded amazingly. I gained 30 pounds in 6 weeks, and I gained 300 T cells.
So these drugs have cognitive powers. If you're sick, they'll help you. If you're a healthy athlete, they'll kill you. How can you say that steroids are a national public health crisis when you have people dropping dead at a rate you can measure by the minute as a result of alcohol and tobacco?
According to the CDC, tobacco kills about 435,000 Americans every year. Alcohol kills about 75,000. And deaths from anabolic steroid abuse, 3. But steroids also show up in some other statistics, emergency room visits. But it's not exactly number 1 on the list. That would be alcohol. Or number 2, that's cocaine. Or number 3, that's marijuana. Gotta be top 10 though, right? Not quite. How about top 25? Top 100? Keep going. Try number 142. That's even after multivitamins.
Education is important, but what you have to watch out for is embellishing. If you look at reefer madness, it causes you to be a stark raving, murdering lunatic. Very funny to watch because it goes so over the edge.
The next tragedy may be that of your daughter, or your son, or yours.
Physicians and sports scientists have done that with the best of intentions in this area. Oh, steroids are going to cause you to drop over dead in your tracks and so on. And the athletes are looking around and say, geez, I haven't seen that many guys die.
Are steroids killing people?
Steroids clearly are killing people, both in the short term and in the long term.
Dr. Gary Wadler is an advisor to the World Anti-Doping Agency and the media's go-to guy when it comes to steroids.
We know it's been associated with stroke in young people, for which there was no other obvious explanation. We know it's been associated with heart attacks, for which there was no other obvious explanation. We know it increases clotting.
What bothers me is people like Dr. Gary Wadler, who's a physician, and going before Congress and saying these things. And when confronted, please produce a single article that shows any of this in any scientific way. Can't do it.
Dr. Norm Faust is a professor of medical ethics with a research focus on performance-enhancing drugs.
I'm not denying that there aren't some serious adverse effects from anabolic steroids. It's just that we haven't been able to demonstrate any of them. Maybe that's because we don't study them. One of the problems with the ban on steroids is that it's impossible to do the kind of research that would answer these questions.
Some purists would like to see those studies done. Well, I can assure you they never will be done. It'd be a totally unethical study to do. So we have to use the information we have at hand.
Depression, convulsions, anxiety, jaundice, myocardial infarction, which is heart attack, eczema, abscess, vaginal pain, vaginal discharge. You want to know what I'm reading this from? What does that say?
Vitamin C.
Thank you. I mean, look, peanuts are dangerous. You understand?
Mm-hmm.
There are people that take a peanut, that have a peanut, and they go into anaphylactic shock. Okay? The airway closes up, that's it, they die. Now, does that mean that we ban peanuts and sue God for making them?
No.
Right. What we do is we say, okay, peanut warnings.
There is no safe drug. There is no safe drug that ever exists. There's always a benefit to risk ratio. You name the drug, X% of people will suffer adverse effects.